Now, here are just a few of what I call case killers. Now, I'm sure that you can add to this list, but diagnoses, missing injuries, those are two that I'm going to focus on here today. If you didn't know this already, those two, diagnoses and injuries, are really two of the highest or the biggest value drivers in personal injury cases and working with a third-party software. So when injuries are missed or they're underdiagnosed or poorly diagnosed or misdiagnosed, it can become a problem, becomes problematic for you later on. Treatment compliance is also a case killer. As I'm sure you know, patients having gaps in their care. And that also leads to communication. Wouldn't it be great if your providers actually were better at communicating that the patient had gaps? And I'm going to show you how you can overcome this very easily here in just a few minutes. Another case killer is not having advanced imaging, or sometimes we'll call medical evidence. As attorneys like to call it, or objective biomarkers. They all kind of mean the same thing, objective findings. Advanced imaging is critical to be able to capture this evidence, to be able to relate it back to the precipitating event. And without it, we have a problem with the case. And then just in general, PI-specific documentation, which is a whole, as I'm sure you know, dealing with providers, I'm one, so I totally understand. This is a whole seminar or a whole presentation in itself, is personal injury specific documentation. We don't have that kind of time here today. But also some of the others that you might want to consider: causation statements, functional loss, basically over-treatment, under documentation. Any or all of these, imagine, I'm sure you've had cases where all of these have been in there. It becomes problematic. MRIs, no MRIs, no MRAs, no DTIs. You have providers that are what I like to call the lone wolf syndrome. They go it alone out there. They're the only treating provider. So I totally understand these are all creating a problem for your client as well as the settlement, and creating it more difficult opportunity to settle your cases for fair value or policy limits, and to maximize the recovery. So we're going to focus in and dial it down here today just on diagnoses and missed injuries.
Thank you so much. And like I said, it was an honor to have you guys here with us today. Come back soon. And again, I highly suggest you can stay in touch with our speakers, to reach out to them and stay in touch.